for Medicare and Medicaid Services, CMS, has made some changes that will be particularly harmful to rural health. More specifically, their changes will force doctors into a guessing game about their patients. Mr. President, the condition of payment changes CMS is making would require the physician and no other level provider to not only predict at the time of admission to the critical access hospital that the patient will require hospital care for more than 2 midnights, but also that the patient can be cared for and discharged in less than 96 hours. Now, this is an extremely narrow CMS window for the physician to make a determination about that patient's future needs. Extremely difficult, if not impossible. A physician may certify that they expect the patient to be treated and discharged within 96 hours, but unfortunately, the patient's situation may change, and they may need to be kept longer. The physician's concern will be that they have failed to meet the terms of their certification. According to CMS, this is likely to lead to premature discharges and readmissions, both of which CMS has taken actions to minimize. A CEO for one of our critical access hospitals in Council Grove, Kansas, writes the following: "This new condition of payment rule causes potential conflicts with what is best for the patient, causes issues for the physician in having to predict outcomes at admission in complex cases, and may cause increased expense for medically unnecessary transfers to more costly care centers." So today I am introducing the Critical Access Hospital Relief Act of 2014. My bipartisan legislation would remove the condition of payment for critical access hospitals that requires a physician to certify that each patient will be discharged or transferred in less than 96 hours. This is another example of having to tell CMS if it isn't broken, then there's no need to fix it. We need to focus on ensuring rural patients have access to their health systems, not coming up with bureaucratic ways, Mr. President, to make it harder for patients in rural areas to get quality care from their doctors. I urge my colleagues to co-sponsor the Critical Access Hospital Relief Act of 2014. It would appear, Mr.